Everyone talks about burnout in healthcare, but almost nobody talks about the roles where people actually love what they do. So today, we're breaking down the top 5 healthcare jobs with the highest self-reported job satisfaction and why these careers consistently rank at the top. Hi, I'm Amanda, a pharmacist helping you bridge medicine, wellness, and data to live stronger for life. So let's get into what make these roles the happiest place to work in. Number 1, physical therapists. Physical therapists consistently report some of the highest levels of job satisfaction across healthcare. And why is this? Well, because physical therapists see real, measurable progress every day. They help people walk again. They reduce their pain, help them get back to their lives. And that feedback loop, it's so incredibly rewarding. Physical therapists also tend to enjoy better work-life balance, more flexible settings, and lower acute care stress compared to many hospital roles. It's meaningful work with a very visible impact. And that's one of the biggest predictors of long-term career happiness. So coming in at number 2, nurse practitioners. Nurse practitioners combine clinical care with a very high level of autonomy. They manage patient panels, they can diagnose, they prescribe, and they can build long-term relationships with the people they care for. And yes, I'm talking about patients. Nurse practitioners repeatedly rate their jobs highly because they have real decision-making power. They feel that their work directly improves access to care. They enjoy flexibility across specialties and work settings. And with physician shortages growing and on the rise, nurse practitioners are stepping into incredibly important roles, which boosts both job security and fulfillment. Now we're at number 3, pharmacists. Yeah, pharmacists make this list, but with a major caveat. Clinical, ambulatory, informatics, and patient-centered pharmacists report a significantly higher satisfaction than retail chain settings. You might ask yourself, well, why? Because these pharmacists use the full scope of pharmacotherapy, they work closely with patients and providers, and they make very clear, meaningful clinical decisions. Medication management, chronic disease optimization, deprescribing. We have new categories like pharmacogenomics, transitions of care. These roles offer autonomy, purpose, and impact. As care becomes more complex and personalized, pharmacist-led care is only going to grow. And then coming in at number 4, mental health providers. This includes psychiatric nurse practitioners, therapists, counselors, and licensed social workers. These professionals often report very high career fulfillment because they build these deep relationships with patients. They help patients change their lives overall. They work in environments with a little bit more flexibility than other professions, especially with the expansion of telehealth, which is only growing larger, especially after the COVID pandemic. With mental health demand skyrocketing, these roles are both meaningful and incredibly secure. And last but not least, number 5, physician assistants. Physician assistants have one of the highest satisfaction profiles of any clinician group. They diagnose, they treat, and they perform procedures, but with more flexibility and fewer training years compared to physicians. Physician assistants consistently report high autonomy, strong collaboration with physicians, very competitive compensation, the flexibility to switch between specialties throughout their career, and if you want variety plus impact plus job security, this role checks a lot of those boxes. So what do the happiest professionals in healthcare have in common? Well, there's a couple of things. There are autonomy, flexibility, human impact, and a sense of purpose. It's not just the job title, it's the environment, the relationships, and the ability to practice at the top of your license. If you're exploring a career in healthcare, or you're thinking about making a change, use this as inspiration. There are paths in healthcare that do offer meaning and sustainability.